Today I'm going to show you how to fix your knee pain. Hey everybody, how you doing? It's Blake Bowman here with GuerrillaZen Fitness, and in today's video I'm going to be talking about knee pain, and I'm going to share with you a couple concepts that are going to help you out. Before I begin though, realize that I'm a personal trainer specializing in corrective exercise. I'm not a medical professional, so always make sure to just consult your doctor before doing any of the exercises that you find on my channel. That being said, today is all about knee pain and knee instability. Alright, so oftentimes people like to focus on the area of their body that's hurting, right? So, if their knee hurts, they become obsessed with the knee and they start messing around with the knee. What can I do to the knee to make it feel better? If their shoulder hurts, same thing. What kind of shoulder exercises can I do to make the shoulder feel better? But oftentimes this is just the wrong approach, because the symptomatic area on the body, in this case we're talking about the knees, the symptomatic area is rarely the cause of the symptoms. So keeping in congruence with the philosophy of physical therapist Gray Cook and his joint-by-joint theory, it's really dysfunction that occurs in the tissues and joints above and below the joint that's problematic. The tissues and the joints above and below are usually the problematic areas that are causing the symptoms in the area that is bothering you. So basically, I know your knee hurts, but it's probably not your knee's fault. Now, there are a variety of different causes of knee pain. There's a lot of things that can go on with that joint, but two things that almost everybody with knee pain has in common are: one, poor ankle mobility, and two, inhibited glutes, or just glutes that are very, very weak and are not functioning properly. So you may be wondering what the ankles and the butt muscles have to do with the knee, and I'll explain that in just a second. After I explain it, I'll show you 3 exercises that you can actually do to improve these areas. First of all, with regards to the ankles, most people out there do not have adequate ankle range of motion, right? Most people, they are missing what's called dorsiflexion, which is the ability, if this is your foot and this is your shin bone, dorsiflexion is the range of motion that your ankle has to come up like this, to bring the toes up towards the shin bone. Most people are sort of stiff because of the shoes that we wear, the fact that we're sitting all the time. They lose that range of motion in their ankle. Basically, when this happens, it starts to contribute to knee dysfunction, because the body is always seeking homeostasis and balance, right? And if one joint becomes stiff and it can't move properly, then another joint will typically make up for it and start to develop extra mobility, as a compensation, okay? And when the knee starts to develop extra mobility, which is exactly what happens when the ankle becomes stiff, it eventually leads to something called instability, which is a major precursor to injury. Basically, the knee is not supposed to be very mobile, but if the ankle is stiff, it has to become that way, and now physical forces are acting on the knee in a very adverse way, even when you're doing simple activities like walking. So you need to be able to have adequate range of motion in your ankles in order to do things like walking, running, squatting, or anything with your legs properly without the knee having to make up for the ankles. So that's why ankle range of motion is important. Now I want to talk about glutes. So the glutes actually function, your butt muscles function to actually stabilize the knee, okay? When they turn on, they help prevent uncontrolled, unintentional motion from occurring within the knee joint, and that is called stability, right? And it's the glutes' role to do that, okay? And in most of the population, most people have inhibited glutes that are weak. We're sitting on these things all day, they become weak, okay? And when a muscle that's primarily responsible for stabilizing the knees becomes weak, then it's not going to be able to do its job of stabilizing that area, and it's going to allow instability to kind of creep into the knee joint. Now just think about how bad your knees would hurt if both your ankles were stiff and missing range of motion and your glutes were weak, right? Your knee would be sandwiched in between 2 dysfunctional areas, and believe it or not, that's actually very, very common with my clients. Alright, so now I'm going to show you some exercises that you can do about this. I'm just sharing with you general concepts here. You can do with this information whatever you want, but I'm going to show you 3 exercises, 1 for the ankles and 2 really good glute exercises that should be fine on your knee. Alright, so the first thing we're going to do is mobilize the ankles, okay? And all you need to do this is a wall, okay? And basically what you're going to do is you're going to position your toe far enough away from the wall so that you can fit about a fist's width in between your toes and the wall, okay? And what you're going to do is you're going to keep your heel planted firmly into the ground. You're going to drive that heel into the ground. As it stays planted on the ground, you're going to drive the knee forward at about a little bit of an inward angle here, and you're going to touch the wall with the knee, and you're going to come back. Okay? You're going to do 15 to 20 of these in this direction, and then you're going to go straight forward. Same thing. Make sure that that heel stays planted. Okay? You're going to do some going forward, and then you're going to do some going out at an outwards angle. Okay? Kind of like towards your pinky toe. Okay? And basically this is how it's done. You have to keep that heel planted. We're forcing that ankle to dorsiflex with this exercise. If you're not able to do it from a fist width, then basically reduce the distance between your toes and the wall. But just keep in mind that that really indicates that your ankles are a big problem for you. And you should probably focus a little bit more on mobilizing the ankles. Because really that's a test. If you can't do it fist width away from the wall, then that really indicates that you're lacking a lot of mobility there, and this exercise you should be doing it a lot. Alright, so now I'm going to show you two of those glute exercises. I'm a big fan of these. They don't load up the knee with a lot of weight, and they really target the glutes effectively. Alright, so this exercise I love doing because it's just awkward to demonstrate. It's a great exercise though, and this is really going to help to activate the glutes while sparing the knees. Okay, it's called a cable pull through. It is kind of awkward, but you basically want to set a cable machine down pretty low. You want it to be, you know, approximately at the same height as your knees, maybe a little bit higher than that. But you're going to put a rope attachment onto a cable machine, and you're going to grab it between your legs like this. Okay, it's kind of weird, but trust me, you're going to feel this in your glutes. You're going to get into a wide stance here, and you're going to keep your spine neutral, which means you're not bending from the back. You're going to keep a neutral spine, but you're just going to hinge from the hips like a door hinge. Okay, and then you're going to like violently thrust the hips forward and really squeeze your butt muscles really hard. Really squeeze them as hard as you can. We're trying to maximize glute contraction here, your butt muscles. Okay, inhale, exhale. You kind of want to explode with the glutes and really squeeze them hard, right? Kind of even pause here for a second to give them an extra squeeze. This is, like I said, it's a great movement. You know, I would tell you to do barbell hip thrusters as an alternative to this, but if you're somebody with knee pain, then loading up your body with weights is probably not something that you want to do right now. So this is a really good alternative to the classic hip thrust in terms of isolating the glutes and really strengthening up that area while avoiding loading up the knees. Okay, so this last one is called a side lying leg raise. It's very easy to do. We're trying to target the glutes when we do this, okay? So you basically just lay on your side like this, rest your head on your bicep, and then you're just gonna raise that top leg up in the air. Make sure that the toes point forward. Don't allow the toes to point up. Toes pointing forward, stay laid down right here, okay? Go up as high as you can, and you want to do an even amount of sets on your right side as you did on your left side. There you have it. Cycle those into your routine and let me know how they go for you. I'd recommend doing these about 2 to 3 times a week. Okay, so do about 20 reps in each direction for the ankle mobilization. You want to go inwards for 20 reps, straight forwards for 20 reps, and outwards for 20 reps. After that, you want to do about 4 sets of 15 reps for cable pull-throughs. And then you want to do about 4 sets of 15 side-lying leg raises. To make these exercises more effective, you always want to integrate, which means use the body in an integrated fashion, right? What these exercises do is they isolate things, right? So the ankle mobilization mobilizes the ankle, it isolates that, and then the glute exercises activate the glutes, okay? But you really want to train your whole body on how to, you know, move properly as one integrated unit, okay? And one really easy way to do that after doing these exercises is just to go on like a 10 to 20 minute walk, right? Make sure that that ankle is fully bending after you've mobilized it, and also make sure you're squeezing the glute when your leg is back in this phase of your gait. So when it's going back, like squeeze the glute, so on and so forth. That will retrain your body and teach you how to get, it'll basically teach your body to use that new range of motion and to recruit your glutes in a functional situation. Wow, that was hard to say. Alright, so that's it for this video. If you haven't yet downloaded my ebook, Posture, the Ultimate Life Hack, then definitely do that. there are a lot of things upstream from the knees that can contribute to knee dysfunction. Anterior tilting of the pelvis is one of them, and that's a common postural distortion that I cover in my ebook, Posture: The Ultimate Life Hack. So make sure you download that. It's free. In order to get access to that, just open up the description down below and click the first link available there. What that will do is it'll take you to my webpage where I'll ask you for your email. As soon as you enter that in, I'll send the book straight to you. You can also get access to that book and that webpage by going right here. Just hover over that and hit download. If you haven't yet subscribed to my YouTube channel, go ahead and do that over here. And if you want to see more videos like this one, then check this out right over here. Other than that, as always, I appreciate you for watching, and I'll see you next time.